Most of the doctors, their handwriting is very poor.
Sir, if you had the opportunity to design one national level initiative to improve health outcomes, what would it be?
Insurance coverage to every Indian.
गवर्नमेंट की जो स्कीम्स हैं आयुष्मान भारत या नेशनल हेल्थ मिशन ग्राउंड लेवल पे जब आप उनकी बात करते हैं
Ayushman is one of the it's largest scheme of the world, cashless scheme of the world. I think around 70% of the population of India, that is Bharat, lives in rural areas. 70% of the healthcare infrastructure, including the manpower, doctors, nurses, paramedical staff, ICU beds, hospital beds, they are all confined to tier 1 cities, metros only. There is definitely, this is a paradox. Capex and OPEX, operational costs, both are very high in healthcare sector, especially in hospital industry.
Hello, Namaskar everyone. I am Tanistha Ankit, and on behalf of Pulse of Positivity, I welcome you all to this talk. We have Dr. D.K. Gupta with us. Pulse of Positivity is a healthcare and wellness magazine dedicated to inspiring happier, healthier, and balanced lives. It serves as a platform that incorporates real-life stories, knowledge, experience, expert insights to promote awareness about physical, mental, and emotional well-being. So, sir, I welcome you today to this talk, and it's been really a pleasure. And thank you for giving us this opportunity to have your insights on healthcare.
I'm most welcome, ma'am. Thank you so much for giving me opportunity and blessed. Thank you, ma'am. But I'm pleased.
So first I'll take the opportunity and pleasure to introduce you for our audience. So Dr. D.K. Gupta is a distinguished healthcare leader, paediatrician, and entrepreneur known for his commitment to providing affordable, ethical, and technology-driven healthcare in India. As the chairman and managing director of Felix Hospital, Noida, he has built one of the most trusted names in patient-centric medical care and hospital management. A medical doctor by training and a visionary by spirit, Dr. Gupta combines clinical excellence with innovative healthcare entrepreneurship. He is an advocate for universal health access, digital health transformation, and rural healthcare strengthening. Through his leadership, Felix Hospital has become a model for integrating compassion, efficiency, and modern technology in healthcare delivery. Dr. Gupta is also an author, a frequent speaker at national health forums, policy discussions, and leadership summits, where he shares insights on hospital management, public-private collaboration, and the future of healthcare innovation in India. Thank you so much, sir.
Thank you, ma'am. Thank you.
And I welcome you to this talk. So, starting with your own personal journey, sir, what drew you, like when you were a child or a teenager or an adult, what drew you to the healthcare sector, and how has your professional journey been evolved over the years, itne saalon mein? And since you are a doctor and an entrepreneur also, how come you balance your clinical practice with entrepreneurship?
So many questions in one go. Thank you so much first.
Yeah.
And my journey of being a doctor started in my childhood only, and when my father expired and he died at premature age of 49 years only. And at that moment of time, he was suffering from several diseases like diabetes, high blood pressure, asthma, COPD, tuberculosis, heart failure. He died, and that moment of time, there was a vivid dream to become a doctor. Nothing else, not a great vision or not a goal, but still that vivid dream evolved with the time to be a doctor in further course of time. And during that journey, there were lots of roller coaster drives. And because I lost my father, so I had to fund my studies by myself only, did lots of odd jobs to fund my studies. And There was a challenge also. My seat was lost. My seat was sold out to someone else and the seats after giving PMT exam. And when I came to know that I fought with the government, bureaucracy, and everybody supported me from peon to chief minister. The journey was quite long, but in brief, from peon, deputy secretary, special secretary, section officer, secretary, principal secretary, secretary to CM, everybody, including several ministers, I met them. I told my problem, what happened to me, and convinced them, enrolled them. Finally, they helped me, and finally, I got my seat also. Because of lots of struggle and lots of tough time, hard work during that struggle in the bureaucracy and political galleries, the value for MBBS was quite high for me. जो चीज़ आपको मुश्किल से मिलती है तो वैल्यू बढ़ जाती है. So then I was one of the gold medalist, topper of the my batch, and had several distinctions, honors. I used to fund my studies during that period of time also by operating my mess of the hostel. But finally I got my selection in MD also. I did MD pediatrics from Lajpat Rai Memorial Medical College. Same MBBS and MD I did from the same institute, LLRM Medical College, Meerut. MD also I was gold medalist topper. After that I joined government job because I don't had money at that moment of time to start any clinical practice or any nursing home. So I started my journey with starting my career with a government job in Municipal Corporation of Delhi. Worked for 8 years there from 2007 to 2015, 14-15. My wife started a small clinic during that period of time. She was also pediatrician. She started a clinic in Noida only, rented accommodation. And from clinic, she started a nursing home. From nursing home, it closed just after opening of it because of some Supreme Court order, Honorable Supreme Court order. In residential area, you cannot operate banks or any other non-residential activities like nursing and all. And we went again court and we got some relief from court in terms of there was a special scheme launched those who were displaced during this process of nursing home and bank shifting. So after that I got that plot for nursing home in Noida for hospital, and because I don't have fund at the moment of time, so I approached several BCs, Ps, but everybody refused. I also approached my friends and relatives, they funded me, sold out my properties, residential properties, farms, and took loan from NBFCs. And after that, I got allotment for that land from the authority. Was lucky enough to start that project, and then approached several banks, government banks. Few of them they give sanction to me and got term loan from these banks, and after this getting the fund, I commissioned the project within the lesser than estimated time. The time was given for 2 years to construct the building and 1 year was the moratorium. I started my hospital within 15 months of its operation of constructing a building. The DCCO was prematurely 9 months before as given by the bank, and after that because to run a hospital you need lots of empanelment, lots of accreditations, statutory compliances, licenses. So we were very fast because we were in survival phase. That for that all these things we did in 9 months to 1 year only. We got NAVH, NAVL, GIPSA, CGHS, ECGS, ESI, all that empanelment, private government within 1 year of its operation. And finally we made this hospital in break-even also within 18 months of its operation. That was the whole journey of my entrepreneurship for the phase one.
My second question to you was, how do you balance now your clinical practice and this entrepreneurship journey?
I think this question is not very appropriate at that moment of time because whosoever is doing entrepreneurship, he has a passion for that. He has a commitment for it. He loves doing hard work. He loves doing.
So let me rephrase that question. So what motivates you each day to work towards that vision that you have for healthcare in India?
That's the question.
Yeah.
I think somebody who is having purpose in life, a bigger purpose.
Yeah.
then there is a motive, there is a drive, there is inspiration, there is a passion coming out from inner self only.
Right.
So I have a purpose of serving people, person who are living in tier 2, tier 3, tier 4 cities, who do not have accessibility to the healthcare, and the healthcare is also not affordable for them. When my father died, so I had the dream to serve people, those who can, we can get them in a mainstream and provide service in form of quality care and
Right.
with the safety of patients also. That was the purpose, to provide larger number of people healthcare services, being in predictive, preventive or curative healthcare services. So we are not working only on treatment part.
Right.
That is not our prime objective. Our prime objective is to provide predictive healthcare services, preventive healthcare services and curative healthcare services, even palliative healthcare services also. And up till the doorstep of the patient. So the whole the journey of the patient should be comfortable. There should be all connection points should be matched, and there should be the patient should have great experience on these connection points also. So that is our vision. So and the vision comes from our purpose only. Because of that purpose, we have good passion, we have a good team, committed team, hardworking team, we are having very good attitude, and with that team we have grown from a small clinic to now chain of hospitals having around 850 beds in next 1.5 year only. So that is, I think, your question.
Yeah. So sir, of course, इतने time से like when you work there must have been many challenges that you faced, especially from this systemic angle, like government की तरफ से या जो government की policies हैं उनके basis पे, and especially how do you incorporate government की जो schemes हैं, आयुष्मान भारत या national health mission, ground level पे जब आप उनकी बात करते हैं तो उसमें क्या challenges आते हैं उनकी implementation के लिए?
I think there is no challenges if you understood the process and system and procedure of the government scheme. And definitely there is some delay in payment process right now, but I think it is also, with the time, it is also being normalizing. But if you understood the policy, the Ayushman is one of the it's the largest scheme of the world, cashless scheme of the world, I think. And as being a healthcare partner, we should support government also, because we are spending around 2.5% of the GDP. That means we have very less budget for healthcare. It should be around 5% minimum as per WHO guidelines, and developed countries invest around 10 to 15% of their GDP on healthcare. So with a limited budget, we have to align with the government, we have to align with the patients also. Cost effective, quality care of treatment should be provided through these schemes, being with NHA like National Health Authority, Ayushman, or maybe CGHS scheme. Means so, and now the CGHS rate has been also revised a little bit better also. So I think there is no challenge at itself, but you have to understood their process also, and now they are all the things are now they are automated also, they are digitalized also. Like billing process is also digitalized, admission process, extension process, discharge process, everything is automated and digitalized. Everything can be measured, controlled and tracked also. So there is nothing to be, I think, blamed to government, or government cannot blame to hospital also. Or everything is genuine and transparent.
Right.
That's my point, I think.
Yeah. Sir, हम जैसे digitalization की बात करते हैं ना, तो of course there are so many things, artificial intelligence आ गया है, IoT आ गया है. So have you noticed like इन सब चीज़ की वजह से that there still is a rural and urban divide when it comes to the treatment of patients and accessibility to patients who are specifically in the rural region of the country?
Around 70% of the population of India, that is Bharat, lives in rural area, tier 2, tier 3, tier 4 cities exactly. And the 70% of the healthcare infrastructure, including the manpower, doctors, nurses, paramedical staff, ICU beds, hospital beds, they are all confined to tier 1 cities, metros only. There is definitely, this is a paradox, and it is gradually it has been covered up by the government also. Now government is the government is converting district hospital to medical colleges, upgrading them. Also there are lots of nursing colleges are opening in the each districts. They are supporting them, promoting them. DNV seats has been raised, increased medical MBBS seats, MD seats has been increased in different medical colleges. That is good initiative, good start from the government side. But definitely to establish a hospital in any area, it requires lots of fund, lots of capex in terms of land, building, plant and machinery. And till now there is no subsidy on anything. Government is planning to give subsidy. I think there will be few schemes coming up very early that the hospital owners or your investors who want to invest in tier 2, tier 3 cities, they will have subsidies in terms of the registration fee, land may be given to them free of cost, or maybe there can be some plant and machinery subsidy also. But still it is on paper. I think very soon it will roll out. There is like lots of cost for investment in building a hospital. It costs around 1 to 2 crore per bed to establish a hospital, and after establishing that hospital, you need a lot of manpower, skilled manpower like nursing, paramedical staff, doctors, resident doctors, and they are difficult to find in tier 2, tier 3 cities. And if you get them from tier 1 city, the cost will be very high. So therefore, the capex and opex, operational cost, both are very high in healthcare sector, especially in hospital industry. That's why it's difficult to run. There is a gap in tier 2, tier 3 cities and tier 1 cities. Whenever we will, like, there was a lot of gap in the infrastructure also and law and order also in previous governments and previously. But now law and order is very good in government of UP and other parts of also. There is also very good road infrastructure had been developed. The accessibility to a tier 2, tier 3 city is now very good. But definitely, I think skilled manpower and capex investment, there should be some support from the government side so that we can, because to run a hospital and make it profitable, it at least take 3 to 5 years.
Right.
For that time, we need some support in terms of funding, financing. It should be a subsidized rate. I think few initiatives should be taken in this area also.
Right. Yeah, so thank you for sharing that. And अभी क्योंकि हम डिजिटलाइजेशन की बात कर रहे हैं, so हम इनोवेशन को भी नहीं रोक सकते हैं उसमें, स्पेशली सिंस हाउ दीज थिंग्स हैव इवॉल्व्ड ओवर द ईयर्स. सो सर, आपकी प्रैक्टिस में हैव यू लाइक, भले ही आपका खुद का या आपने नोटिस किया हो, कोई ऐसा इनोवेशन हेल्थ केयर सेक्टर में दैट हैज़ मेजरेबल अमाउंट ऑफ पब्लिक इम्पैक्ट जो आया हो, कोई ऐसा इनोवेशन जो आप शेयर करना चाहें?
वेरी गुड क्वेश्चन. आई थिंक most of the doctors, their handwriting is very poor. And whenever they prescribe some medicine or some advice, even they, after prescribing, sometimes they don't understood what is they have written in that prescription. And that goes to the chemist also, goes to nursing department if patient is admitted, and on that basis the medications is given. Because of that poor handwriting, the legibility is very poor of these prescriptions. Sometimes medication error can be there. It can be life-threatening also. So I think EMR, electronic medical record, is one of the very good module of any HIS or any hospital. If they have implemented, it reduces the mistakes, the prescription errors by the doctors, even by nurses. Everything can be tracked, controlled, measured, monitored, and safety of patient has been improved quite a lot. And that is the most important point. Like our hospital also, our motto is quality of care and safety of the patient. In my language says the same thing. If you do something like this in any area that was lagging behind for decades, like there were several startups also, those tried to convert these papers into the like in written document, but I think they were not very successful. But now good hospitals, they have EMR and they have implemented also. Like our hospital, we have fully digitalized hospital, fully implemented EMR also.
Okay. So sir, since again हम किसी भी चीज़ को जब स्पेशली रिकॉर्ड्स को डिजिटलाइज करते हैं, so again the question arises with respect to the data privacy, and अभी data privacy को लेके इतना चल भी रहा है. So again my question to you is कि हम कैसे दोनों चीज़ों को बैलेंस कर सकते हैं कि data privacy, especially like because a patient imposes his or her trust in the hospital, and the hospital is accountable for certain things.
I think process is the same. Data privacy is well maintained in the digitalized form. If it was offline, it was in papers, data can be leaked. But if it's digitalized in the system, in the process, somebody without having like login ID and password, it cannot be like stolen. Therefore, data privacy is very good in digitalized, or somebody who's using HIS and EMR. If somebody hospital is not using it, then MRD section they have, or they have some different department to storage of these data. There is a possibility of leakage of data. But in EMR and HIS, there is a minimal, or very minimal probability of leakage of data. And also there is a data privacy document has already come Gazette of India last, I think 2-3 days back only. I think government is also working on the data privacy. We will very soon we will have bill in the parliament also.
And so sir, tell us any real life example wherein you have faced in your practice any ethical dilemmas with respect to either your practice or your entrepreneurship, any ethical dilemma that you faced, and how did you navigate those dilemmas?
मैं ethical dilemmas normally जब face करते हैं जब आपको कुछ dichotomy हो, तो we as a hospital we are very have clear vision, clear goals, clear directions, clear core values that we are patient centric. When you are patient centric, then there will not be any ethical dilemma. तो आई थिंक सब कुछ पेशेंट पे फोकस करेंगे तो एथिकली सब कुछ ठीक होगा. अगर पेशेंट को बाहर करेंगे सेंटर से, देन एथिकली डायलेमा आ सकते हैं. तो ऐसा मुझे कोई ध्यान नहीं आ रहा है कि कोई बड़ा चैलेंज आया हो.
ओके, so how can India position itself as a global hub for affordable and quality healthcare, especially in medical tourism and digital health exports?
I think India has already positioned as a very affordable medical hub, place for medical tourism, and I think medical value travel is doing great job. We are having patients from different countries, even from European countries, Russia and Middle East, SAARC countries, and our rates are quite low as compared to these developed countries, even 10 times low. We are very affordable, and our doctors are very qualified. They are very talented, very skilled. This type of doctor you cannot find anywhere in the world. So with the good skilled doctors, medical manpower, nursing manpower, we have world class equipment comparable with the Western countries. We have system process. We have digitalized everything. We have HIS, EMR. The same quality of care, or even better quality of care than developed countries, we are providing it 10th of price. So I think that is going very great, and with this I think CAGR, cumulative annual growth of medical tourism, is around 30%. So we are doing great, and within next 5 years, like in Noida also, Jewar Airport is coming. It will also enhance medical tourism to this region also, Western UP region also.
Okay, so if you had the opportunity to design one national level initiative to improve health outcomes, what would it be?
Insurance coverage to every Indian.
Okay. Would you like to elaborate on that?
Yeah, like in most of the developed countries, like health is our right.
Right.
Fundamental right. And this is responsible by state. And because of lower budgeting, they are not able to provide insurance cover to everybody. But still government is trying right now. They have covered around 50 crore of population with the Ayushman scheme only. But the middle class is right now missing. They don't have very good insurance coverage. So I think if we have very good insurance coverage to all the Indians, with giving good rates to hospital also, so that the hospital can provide quality of care and having safety of patients in their hospitals and their infrastructure, then I think it will be very good. So if there is a chance, then we will improve GDP expenditure from 2.5 to 5%, and if it improves, then definitely we can cover all the Indians under one roof, under one scheme, so that there should not be any difference of quality of care to any patient.
Yeah, so I guess that's the need of the hour, and that would be a really great initiative to make healthcare inclusive and again accessible to every doorstep. And again, with respect to, क्योंकि अगर हम इंडिया के कॉम्प्रिहेंसिव हेल्थ की बात कर रहे हैं, तो सर हम इन सब चीज़ में कॉम्प्रिहेंसिव हेल्थ में मेंटल हेल्थ और इमोशनल हेल्थ को अब नहीं छोड़ सकते हैं, स्पेशली इन टुडेज टाइम. सो हाउ कैन इंडिया इंश्योर दैट द नेक्स्ट हेल्थ केयर रेवोल्यूशन इन इंडिया is about holistic health, which is integrated in nature and comprehensive in nature, and taking in picture not just the physical health but mental health and emotional health as well. And how can we move to a more comprehensive wellness regime in India?
A wonderful question, I think. Holistic healthcare includes physical health, mental health,
Yeah.
emotional health, spiritual
Health, yeah.
social health, sexual health.
Right.
So if we have access to all these verticals of healthcare, and every citizen if have access and can get treatment, or can get counseling, can do spiritual things, emotional things there, then I think it will be beneficial and it will be very good for each Indian. So government is doing great in that area also, like they have opened lots of wellness center. Previously our budget was around 100% on treatment part only. Now the budget has reduced to 90% of treatment, but around 10% goes to the wellness part also. They have developed several centers of Ayurveda, homeopathy, Ayush, providing wellness care, and there is also integration of these medicines also. And I think government is very serious on the integration of these medicines, allopathy, Ayurveda and other Indian pathies, so that patient can get best of them from each of these pathies. If we need yoga, if we need meditation, it should be given. If we need some allopathic treatment, it should be given. If we need some homeopathic treatment, it should be given, if it is best for that patient. So keeping the patients in the center, all these subspecialties should be integrated, so that best of these subspecialties can be offered to the patient for their better outcome of disease.
Right. So, sir, what advice would you like to give to someone who is just entering the healthcare sector now that healthcare sector has completely changed, and someone who is either bringing an innovation or starting an entrepreneur journey? So, what advice would you like to give to your juniors and young individuals?
Anybody in any field, if you want to enter in any field and if you want to do entrepreneurship, just see if you have a bigger purpose, bigger than you, bigger than your family. It should impact at least thousands, millions of people in country. Then you should start it, think of it. If you have bigger vision, bigger purpose, then definitely you will be passionate enough to do hard work, to have a good commitment. Otherwise, the best is to avoid it, but it is also very competitive. 90% of the startup shut down within 3 or 4 years of their starting. And if you have commitment, if you have passion, if you have bigger purpose, definitely this is the best area. You should go it, and I think you should fulfill your dreams also and help and serve others also.
Okay, so अब हमने इनोवेशन की बात की है और आपने यंग इंडिविजुअल्स को बोला है कि एक बिगर पर्पस होना चाहिए ऑब्वियसली. सो सर, अगर हम कोविड-19 की बात करें, एंड वी नो लाइक व्हेन कोविड हिट, सबसे ज़्यादा जो हिट हुआ था वो हेल्थ केयर सेक्टर था. सो ड्यूरिंग दैट टाइम वुड यू लाइक टू शेयर कि आपके क्या लीडरशिप लेसन्स रहे उस टाइम पे? हाउ डिड यू मैनेज एवरीथिंग, एंड वट लाइक ये चीज़ जो आपने उससे सीखी, हाउ वी कैन गिव इट टू अगेन टू द यंग इंडिविजुअल्स?
आई थिंक पैंडेमिक given us great learning to doctors, hospitals, government, like administrative teams also. Communication, I think, was very poor at that moment of time. I think communication should be improved between the government and private sector, hospitals and government peoples. And also we should focus lots of, because after COVID only, we learned a lot of lessons, so that we are now focusing on improving healthcare infrastructure, especially in tier 2 and tier 3 cities, where we were lacking of ICU beds, normal beds. Treatment was not possible to patients who were suffering from COVID. They have been referred to the tier 1 cities, and tier 1 cities were also overloaded. So I think now government is also has changed their perspective. Like they are now moving towards the tier 2 and tier 3 cities. They are supporting private sector also. They are coming up with the new schemes also to support them. Private-public partnership is growing right now. So I think there are lots of things happening after COVID, because we learned a lot.
Right.
Early diagnosis, prompt treatment, screening programs, and like hand hygiene. What can we do for the prevention of such diseases? And such diseases happens again. So we are well prepared right now. So I think very good learning from COVID.
Okay. So, sir, again, since you mentioned about public-private partnership, how much is it important, and how much, again, on the ground level? So, what are the challenges that we face when it comes to this public-private partnership, and how this collaboration can impact the healthcare sector?
I think 70% plus healthcare delivery comes from private players only. Being it OPD, diagnostic lab, radiology, pharmacy, or indoor patient treatment, surgery and all. And only 30% comes from the government hospital institutes. So there is a great gap right now. And if you want to provide healthcare services to all with good quality and safety of the patient, definitely you need support from private players. So there is the need of private-public partnership because of this gap. And if government is really focusing on that, and right now government is doing great thing in this area also, like they have opened lots of centers, lots of diagnostic centers, dialysis centers, medical colleges are running, district hospital has been managed by, even CHC, PSC is being managed by right now private players only. But it should be very clear, very transparent. Policies should be private player friendly. There should not be delay in the treatment part, payment part, and system and process should be fully automated, so that everything can be tracked, controlled and measured, and there should not be any problem for government or private player. The policies should be very clear, transparent, and fully communicated in advance with the their interpretation should be very clear. And it should be hospital friendly, like private player friendly, because they need also funds from different banks or private equity players, BCs, or this public market. And when you take this fund from these players, they definitely require some ROI from this investment. And if you want to revive this healthcare sectors and sustainable and scalable form, then definitely you should make them profitable, and they will provide some benefit, some ROI to their investors also, and the industry will be growing also. If you're not allowing this, and definitely it will, after some time it will be collapsed.
Sir, since you already mentioned that patient services, or the focus has to be on the patient is the supreme. So my question to you is specifically for the patients who are terminally ill and on the verge of dying, how can healthcare professionals incorporate compassion along with their, of course, their work, technology and whatever it is, but how can that element of compassion be incorporated in their practice, especially when it comes to terminally ill patients?
Very good question, and we have lots of patients who are suffering from terminal disease who requires palliative care in terms of pain relief, in terms of supportive care, and this can be managed in their homes only. They need not to be admitted for this type of care in hospital, because they will have very good environment in their house or residence when it is provided at their doorstep. In that segment, actually, especially the home care vertical comes. So now we have very good home care companies or healthcare partners right now in our Delhi and in Pan India also. Those they are providing very good care to these type palliative ills. Definitely, compassion, empathy is one of the core values that should be offered during this treatment. Sometimes it is lacking because the staff is not trained, their soft skills, grooming, their communication is not very good. So I think most of the time there is a lack of training only. So if home care companies or hospitals, those who are providing home care services, they are very focused on quality, training, audit.
Quality, training, audit.
Quality of care, repeated trainings, audit, and again giving feedback, coaching, mentoring to the team so that the quality can be improved. So if it is done, then definitely we will have compassion also, we will have empathy also, and should be paid in terms of very good, like remuneration should be given in good amount to them, those who are working at home also.
Right. सर, सिंस हमने टर्मिनल इल पेशेंट्स की बात करी तो हम चिल्ड्रन की भी बात करते हैं. हमने अभी पिछले कुछ टाइम पहले अनफॉर्चुनेटली वी हैव लिसन टू मैनी केसेस wherein like the infrastructure size of the hospital is very small, as compared to the children who are getting delivered there or who are getting treatment there. So how do you look at such situations wherein healthcare professionals have opened up hospitals, but they are not able to provide that level of services that is required, especially in the cases of children?
I think there should be some regulatory mechanism from government only, like hospital should be at least NABH and NABL accredited hospital. All hospitals should be, so that quality and safety of patients should be taken care of. So because of unorganized healthcare sector, lots of lab testings, diagnostic companies are running without any accreditation, without any licenses, without any empanelment, and providing poor quality of services, poor quality of reports. So I think because of this, the treatment will be poor quality, or it will be not targeted. It will be difficult to treat a patient. So I think this should be curbed. And any hospital, any nursing home, any clinic that has been run by any medical professional, it should be registered with the local health authority. There should not be like Chola Chap or then any doctors, those who are not having qualified degree. And if somebody is having degree also, and he should practice same pathy also. That will be, I think, very good idea, so that we will not give something to patient that is not known to me only, or impact it will have, because I have not read that in my career. I think qualified doctors, accreditations, local authority registrations, empanelment, and regular visits, regular site checks there, and audit of the hospitals, nursing homes. If you do all the accreditation, of all these hospitals, I think it can be covered.
Yeah. So sir, now since you have already shared again about your vision, about your motivation and your purpose, I would like to know about your personal routine, like everyday things that you do on a day-to-day basis, some of your habits that keeps you going.
I wake up early in the morning, I do exercise, yoga, meditation, little bit of jogging. So I keep now around 1.5 to 2 hours daily for my health. And I expect same from everybody who is listening right now. Health is your wealth.
Health is wealth.
Please focus on health. That's one point. Then I go to my office and work for an 8 to 10 hours, 12 hours, or 14, 16, depending on the requirement. That's all. Nothing else. So I am a workaholic. I love working. I'm focused. I do each and everything aligned to my goal only. No deviation from goal. That's
okay. And sir, since again we are now nearing towards the end of the interview, I would like to ask you, what legacy do you want to leave behind in the field of healthcare, as a doctor, as a visionary, as an entrepreneur, and as a nation builder?
जब मर जाओ तो लोग आपको अच्छे डॉक्टर की तरह याद रखेंगे, लोगों अच्छा इंसान था जो गया है,
राइट?
ठीक है, अच्छे लोग आपको जनाजे में शामिल हो, ठीक है, और साथ में याद करेंगे कुछ अच्छा करके गया है. That should be legacy, so that everybody remembers you, that a good person has left, and his work remember. जो मेरा काम है वो याद किया जाए बाद में. That's more important.
So what you're saying, that your work has to speak for itself, and that's the legacy you want to leave behind.
Yes.
Okay. Yeah. So it was really, really nice talking to you, sir, and listening to your insights, listening every single thing that you mentioned about incorporating compassion, about how we can bring that insurance thing into picture, and about the public-private partnership that is the need of hour, and your own personal routine, suggestions to the young individuals. Every single thing is really, really what you shared is impeccable. And on behalf of the team, I thank you.
Thank you so much.
Once again, for giving us this opportunity to talk to you, and it was a pleasure talking to you and having
Really, it was a privilege for me. Thank you so much.